This is Dr. Tony Akers with Your Inner Wellness on IntellectualRadio.com. And today we're going to be discussing how to use essential oils. Before we dive into our topic today, I want to, of course, introduce my wonderful co-host, Audrey Lee.
Hey, girl. So good to be here again.
Also, we have a very special guest in the studio today who's going to be with us every Monday, Dr. Cortez. I just recently met Dr. Cortez myself, and I was introduced to Dr. Cortez by Audrey. We were at a fair, and he was showing some of the skills that he implements to help people live a healthy life. So I'm gonna take a moment and allow him to introduce himself and to tell you what it is that he does. And then in the middle of the show, you're gonna get to hear a little bit more about what it is that he brings to the world and the community of healing. So Dr. Cortez, go ahead and introduce yourself.
Well, good morning. My name is Ramon. They call me Ray, and my last name is Cortez. Well, I'm very grateful, and I want to thank you, Tony and Audrey, and of course our
engineer
Earl. Thank you so much for the invitation. I am more than honored and grateful to be here with you today. Now, what I practice is called quantum reflex analysis. Quantum reflex analysis and the biodigital O-ring test is actually a highly effective proven technique, university proven, and of medically intercepted reflex points. And what we do with the QRA is we are able to pinpoint, the body has the innate intelligence to read out and pinpoint where there are imbalances in the body.
Awesome. I know that was a mouthful, people, and as you know, you're probably still trying to unpack what it is that he just said, but we're going to get more into what it is and how it will affect everyday life later on in the show. So right now, I want to do a quick recap of what we've discussed over the last 2 weeks. We talked about what is essential oil. We broke down how it's made and how to determine if you're dealing with the 100% essential oils or the fake stuff that's out there. We also talked about the history of essential oils. We talked about how they were first created and discovered by the Egyptians, and then we talked about how the Greek borrowed them, and then we got into the Romans and the Chinese. But in short, there are other cultures that use essential oils all over the world, and we are just here to really help our listening audience see how beneficial using essential oils in your everyday health regimen. We also talked about aromatherapy and what aromatherapy is, and we talked about the difference between aromatherapy versus the fragrant oils. So with that said, we're going to go ahead and dive right into how to use essential oils. And I'm sure people are out there, got their pens and papers ready on writing down some of the things that we're going to share and unpack for you guys today. So the first, I'm going to give you the textbook oils, and then I'll talk about how we use them in everyday life. So the first one I want to introduce, then we're going to talk about direct inhalation, how to inhale those oils, and we're going to talk about diffusing oils as well as internal consumption. So let's start with direct application. Direct application, all of the oils can be applied topically, used with your body and foot massage to the vital flex points on the foot, or added to bath water mixed with Epsom salt or an essential oil bath gel based product. If any oil causes redness or irritation to the skin, you must dilute it with a carrier oil such as coconut oil or jojoba oil or olive oil. Now that's the textbook definition on how to do it directly. And what I want to do is turn it over to Audrey, and I want her to give a couple of examples on how she used her oils on her clients and her customers when she's putting the oil directly on a particular vital point.
Well, one of the things that's really important, Tony, is that doTERRA, which is the oils that we're talking about, are not like the ones we're talking about in stores. So I don't want anybody to confuse that we're talking about the stores or, over the counter oils. We're talking about these specific ones. And we have had the awesome opportunity to work with doTERRA, not just individually, but even because they're in your Vanderbilt Hospital. But with my mother-in-law, probably is the largest, one of the largest testimonies I can share. We know we don't want to claim we are healing anything, whatever the case is, but unfortunately, to some, it may be unfortunate that we can't say that, but fortunately, we can actually see, and our eyes can tell us that our mouths can't say. And what I mean by that is my mother-in-law was diagnosed with colon cancer after having a stroke. She went because she had a stroke to the hospital, rushed there to find out after going through all the things that she went to stabilize her body that she had colon cancer. And they decided that she have it removed. And so that actually took place. But unfortunately, as she came home and done well, she took a turn for the worse. And she ended up with both her kidneys shutting down, putting her on dialysis and then into a coma. And we got to use the oils directly on her, which is why, as you mentioned directly, I wanted to say we got to do that because we were wondering what should we do. The first thing, of course, was to diffuse them in the air because you couldn't touch her. But we know that Jesus used them on his feet. So that's what we did. We used frankincense, one of the primary, I call it the king of all the oils. That's daddy right there. We use rosemary. And we can talk about some of the benefits that as we get into further in some of the shows, talking about the different oils and what their purposes are, and also lavender. Now, a lot of people probably think, I have lavender at home. By using those three oils and the power and that was already as invested in them, we were able to put those oils on her feet. And in 4 days, her kidneys began to function on their own. And in 7 days, she was out of the coma. Somebody might ask, why did it happen? Doctors are doing stuff. It's not. It's not. Doctors do what they're trained to do. Okay. And I don't want to say they're practicing, but they called them practicing physicians. We didn't. We know that God has already innate an ability in the plants to restore our health in Revelations. And when we look at Revelations 22:2 to do that, we're actually just doing what we were told to do. So whether it's you, me, or anybody else, as long as we're doing what's required to do and the instruction on how to do it, everybody should get the same results.
Thank you for that. Thank you for that. And when you talked about the frankincense, it reminded me of a testimony that I shared in one of my earlier shows, how I had a lump in my breast, and thank God it wasn't cancer. It was actually a cyst, and it was the size of a golf ball. And they told me in order to get rid of the cyst that I would have to have surgery. But instead, I did apply frankincense on it 3 times a day for 3 days, and it shrunk the cyst that was in my breast. Because we do have Dr. Cortez in the studio, I want to give him an opportunity to talk about a little bit more about, to kind of unpack what is QRA, and I would like for him to discuss how he used essential oils in his practice when it relates to direct application. So Dr. Cortez, can you?
Sure.
Yeah.
Well, QRA, like I said previously, is a unique and highly effective system of testing the bioenergetic status of the field, which means the energy field. We are composed from the head to the toes, from the inside out, with pure energy. When there are imbalances, this particular type of testing technique will definitely demonstrate where those imbalances are. So then we are able to know when we do a prioritization mode, what particular one area of the body, whether it's a key organ or gland, that's completely imbalanced, that's actually throwing everything out of balance.
Mm-hmm.
So just recently, Saturday, we had a demonstration with Audrey, and of course, Tony, you were here. You were there, I'm sorry. And this gentleman came up, and we were able to, the body, not us, but the body was able to pinpoint, to determine what was taking place. And using the essential oils was incredible. Actually, we used that frankincense. We also used, what was the other oil, Audrey?
Lemon.
Lemon for hydration. And it was amazing. We used 2 other oils, how we were able to turn this particular point. Now, this gentleman, the first time I met this gentleman, and we actually pinpointed that his problems was the pancreas, and he was having issues with pre-diabetes. And so that took care of that. And he was very happy. He was amazed.
Yeah, and I was able to witness this phenomena at this workshop that we were at that Audrey put on. And what was so amazing to me is that Dr. Cortez said, I was like, I did not know that people could be diagnosed with some type of ailment like a diabetes or high blood pressure or something like that, and it actually could be a false read. It could be something else. It could be fungus, or is that correct, Doctor?
Well,
it could be, or like some kind of bacteria.
Yes. Well, actually, for example, now that we're talking as far as diabetes is concerned, the number one is the diet. We all know that a diet plays a major factor, but is that the only factor? Of course not. There's other factors also like infection. And what causes these infections actually are these microbiomes. It could be an expression of a virus. It could be an expression of a bacteria that's taking place. And it's actually, their nesting place is it's the pancreas.
Wow. I want to say a little bit more about direct application, because I know that for those who are listening who are very new to oils or who don't use the oils, they may still be scratching their head saying, okay, exactly how do I use these oils? So I'm going to use an oil that is very common that people tend to buy over the counter, and that's lavender. And I want to just give a couple examples on how you can use lavender in a direct application way. Lavender is very volatile. It's an essential oil. It's a therapeutic. If you use a therapeutic grade essential oil, it can be highly beneficial, and when you apply it to the skin. So for instance, number one, rubbing lavender oil on the feet or on the palms may cause a common effect to the body, and it can help you sleep as well. You can also put a couple of drops of lavender oil on a bee sting or an insect bite to help to soothe the itching and the stinging and the discomfort, as well as putting 2 to 3 drops of lavender oil on a burn to help soothe it. So those are some of the ways when I talk about direct application that you can use an oil to help heal and soothe the body. Before we go into direct inhalation, we're going to take a quick break. So, and then we'll come back and we're going to talk about how to use the essential oils, to inhale the essential oils. So this is Dr. Tony Akers with your Inner Wellness and with Intellectual Radio, and we'll be right back. Welcome back. You are listening to Dr. Tony Akers with Your Inner Wellness on Intellectual Radio. And I'd like to take a moment to thank my sponsors, C&W Plumbing and Sons, where they are doing plumbing and bathroom repair. For more information, you can call Adele at 708-268-6489. And to contact me, Dr. Tony Akers, you can call me at 331-215-4884. We're now going to continue our discussion on how to use essential oils. And next, we want to talk about the inhalation of essential oils. And what I want to do is give you the textbook definition of how to inhale essential oils. And I'm going to turn it over to Audrey, and she's going to kind of unpack that even more. Basically, what you want to do is put a drop of oil in the palm of your hand and rub your palms together. Put over your nose and breathe deeply. Also, you want to try inhaling through the nose, holding the breath, counting to 3, and releasing the air out through the mouth. You're going to try merely opening the bottle, holding up to the nose, and breathe deeply. The bottle can also be opened and placed on a desk or on a counter to reap the benefits of the oil as well. So again, that is just a simple definition on how to inhale the oils to get the benefits. But again, Audrey is going to give you more information on how that's actually done.
I like to liken this to the fact of God when he breathed the breath of life into us. And I call this particular way palm infusion, meaning using your palms as an inhaler. And we do that anyway. We buy people that have respiratory problems that do buy the inhalers and use them that way. But I believe God knew that even in the garden, if we woke up in the garden, could you imagine just inhaling those flowers? We'd be doing that anyway. We would take a flower, put it in our hands, and inhale its essence. And as a result of that, we would cause the limbic center to be stimulated, and now we began to feel differently. So there's really a lot of different ways that I believe God's like revealing all this to us now. Because now is the time, the time is now, because many people are falling by the wayside because they not only don't have these instructions, important not to buy over the counter, and buy from somebody that can educate you, direct you, so you don't hurt yourself, because you can't hurt yourself in taking these in. As you were reading the definition, and of course, you know, it brings back memories, because that's what all this is really all about. Bring back the memories of when you learned all about this with the different techniques. When you teach people that, you think about that movie, Waiting to Exhale, you don't want to inhale. Your people inhale a cigarette, but they also exhale. And so you want to do the same thing. The plants do that. They inhale and exhale. And so we inhale what they exhale. And that's what God meant for it to happen. So we were supposed to do this from the very beginning. We were designed to do inhalation. We're designed to diffuse, and all the other ways we're designed to do that. So I like to say, a lot of times when I can't get people to do some of the other things because they forget, I go, tell your hand, and begin to start infuse them in through your hand, palm and inhalation, and start getting your body to feel better just by doing that.
Can you inhale all oils?
You cannot inhale all the oils. They all have different purposes. They have vibrations, and some of them are too hot to inhale. For instance, oregano. I know people think about oregano. Oh, I use it on my spaghetti. Well, I do too. However, and you inhale it when you walk in the kitchen, but you don't want to use that one because it's too hot or spicy. But there are some beautiful ones like the citrus ones, which are used in Vanderbilt Hospital for a study. And if people want to really see it, they can go to Vanderbilt Hospital and Essential Oil, and they'll see just that particular Fox News presentation of how they talked about how oils were used to infuse, and they changed depression from 60% down to 6%, sometimes even 3%.
Wow. I'm going to give one example of how to inhale oil, and then I'm going to turn it over to Dr. Cortez, and he's going to talk about the foundation of health. One of the oils that people inhale on a regular basis, especially once they get into a new lifestyle of on the path of healing, is the peppermint oil. And peppermint oil is, when they talk about in the Bible, this is the oil of joy. Peppermint is one of the oldest and most highly regarded herb for soothing digestion. There's also a study regarding the effectiveness of peppermint, ranging from soothing headaches to relieving some joint pains. So I want to give 3 examples, and then again I'm going to turn it over to the doctor since we have him in the studio. So inhaling peppermint oil have been known to get rid of headaches, and you can do like Audrey, what you stated, putting it in palm inhalation. You can do that to help with headaches, and that way you don't have to take some over-the-counter drugs to get rid of a headache. Also, inhaling peppermint oil before and during a workout may help boost the mood and reduce their fatigue. So people that like to work out, I always tell them take your peppermint with you. And then rubbing it over your stomach or around the navel may help relieve some occasional nauseation and indigestion, flatulence, and diarrhea. So those are some other ways you can use it. But I do caution pregnant women with not, because that nauseation is something totally different. But those are some of the ways that you can use peppermint. And again, I want to stress. Oh, I'm sorry. This is your oil. I want to just stress to people that are new to using essential oils, get with a health coach, and that way they can help you through this journey of using your essential oils and using them properly. Now, with that being said, I'm going to turn it over to Dr. Cortez so he can kind of unpack for you guys the foundation of health.
Well, and as we were saying previously, the foundation of healing is it's not no science. It's very ancient, just as ancient as the oil is. Everybody has a doctor within that. We just have to help it work.
Mm-hmm.
And the beautiful thing about that I learned as I got into the oils is how effective and how deeply is the healing. Now, in the foundation of healing, we have what is called the neuroendocrine system. The neuroendocrine system is composed of your brain, and also the endocrine system, which is composed of the muscular glands, which is hypothalamus, your pituitary, your parathyroid, your thyroid, your thymus, your spleen, your adrenals, and of course, testes in men, and of course, the ovaries in women. Now, this is very important because this is the communication center of the whole body. You usually find when people come and they get tested, we find that they have what is called the autonomic nervous system block regulation, which is composed of the sympathetic and parasympathetic. And I know those might be big words for everybody in the audience, but it's very simple. We have branches of nerves that are they branch to all the areas of different organs and glands in the body. So, for example, the sympathetic. Let's say you are in the woods and you are being confronted by a bear. Okay, so what are you going to do? Either if you see the bear's going to come attack you, or you're either going to run like you never ran before in your life, or you're gonna defend yourself. So that's the sympathetic, and the parasympathetic is actually digest and rest. So you see, when the body is in a state of confusion, where the communication center is completely blocked, now you don't have what is called cell-to-cell, organ-to-organ communication. Now, this is interesting because as I recently got into the oils. And I realized when a person comes in, they have that autonomic nervous system block, which repels from the umbilicus. I put on their field lemon oil, and it's amazing how that particular area of the body, it starts regulating, up-regulating, down-regulating like it should. So lemon oil, it actually hydrates your body, hydrates your cells, and that's why I use every morning. When I wake up, after I give, of course, my thanks, my to the Lord, I drink water with lemon, and good quality water, of course, not tap water, please.
Thank you, Dr. Cortez. Now, in a few minutes, I'll make sure that Dr. Cortez has all of his contact information, because I'm sure that there's some people out there that probably want to connect with him because he's definitely awesome. You may want to connect with him to find out if you have any energy blockages and what they are and what areas are being depressed or under functioning, so that you can get your health to where it needs to be. I know when I first met him, I take a lot of oils, and he did some body testing on me. And is it called body testing, doctor?
It's called energy testing.
Energy
It's
testing.
actually
Okay.
it's testing all the morphogenic, which is the energy protein reference points of the body. It has to do completely from the top to the bottom.
All right.
Non-invasive, by the way.
Yes, and when he did the energy testing on me, and there were some areas that I could improve in, and I was really blessed by his interaction. So I'll make sure before we end our show today that he provide his information for anyone that's out there listening that may want to connect with him. Because I know for me, when I first started using oils, I was just so impacted by the level of my energy level and how I felt. I was just rubbing oils anywhere, everywhere I could. I was rubbing them on my leg, on my feet, on the back of my neck, sniffing them in. I was like, I just want to feel better. And even if you don't have the knowledge of how to use essential oils to a point where you don't know which oil to put where, if you just start using them on your feet, you're going to start beginning to feel a lot better because of the energy and the intelligence, God's intelligence that's on the oils. So with that being said, we're going to move on a little bit. And I kind of want to talk to, because I'm really intrigued with my dear friend Audrey. She does a lot of work with her clientele using the oils. And I know last Monday you talked about how you were going to meet some of your clients. And if you want talk, I want you to talk to our listening audience a little bit about how you know what oils to use and when.
Well, first I start off with checking the emotions, because that tells me a whole lot before I even get started. Because if I need to bring them in a place of peace, I need to do that first. Because if they're not calm and collective, they don't even hear you.
Exactly.
So working with cancer patients, you talk to them, first of all, cancer can't be felt. Although just like Dr. Cortez said, there's a nerve that goes to the body that's actually being interrupted or challenged, but you really don't feel any pain there. When I was diagnosed with breast cancer, I didn't feel pain. Felt a lump, but I didn't feel pain. But when people get to the point of pain, it's at a stage that Dr. Cortez will tell you, well, we better make a decision. Either we're going to do the right thing or we're going to stay here and say bye-bye and just, head on out. So I start with the emotions, because most of what we deal with is attached to a emotion in some way, shape, or form. It could have happened as a child that you carried it through life and now you activated it, or it could be something you're going through recently. And when we can get to that first, then we can unpeel everything else, and now we can heal in a better way. And if we think about health, the word heal is in the word health.
Thank you for that. I wanted to talk a little bit about carrier oils, because when we talk about direct application, sometimes the oils can be very intense.
Yes.
And since these oils are very potent and they're very concentrated, sometimes people may have like a redness or a reaction with putting the oils directly on their skin. So I want to talk about some of the carrier oils that I use, and we can also talk about the oils that we have with doTERRA that actually already have those oils included for the children. So as a carrier oil, you can use coconut oil, jojoba oil, grapeseed oil, almond oil, avocado, or olive oil. And the reason why I wanted to make sure I took some time to talk about the carrier oils is because sometimes you may have to dilute those oils. You may put an oil on your skin. Let's say if you were using it on your stomach because you had something going on with your digestion, and you may feel a reaction from the oil. You can't use water, to dilute the oils, because the oils are not. There's a reason. What's the reason for not being able to use water? I can't remember.
It intensifies the power of the oil.
That's right.
And then you could end up burning yourself as a result.
So in order to dilute the oil, you have to use oil. So, and those are some of the oils that you can use to dilute the oil for those who are listening. So Did you have anything else to say about the carrier oils at all before we go into
I will
diffusion?
tell you that the oil that doTERRA recommends is fractionated coconut oil. People might wonder, what is that? Because you can't really find it in the store. You probably will start to find it. It's because the fat is taken out because our oils are hypophilic. And what that means is they penetrate right into the bloodstream, just like everything we put on our skin, we actually eat. So lick it up and hopefully it tastes good. But the fractionated coconut oil will keep it from being oily or greasy, if you will, on the skin. It goes right in and it doesn't harm or makes us, have a problem with our clothes because, we all want to be cute.
Thank you for that. Thank you for that. I appreciate it. So we want to talk about diffusing the essential oils. And people ask me all the time, well, where can they get a diffuser? Of course, you can get them through me, Audrey, Dr. Cortez. We all have access to where you can get diffusers. But I want to talk about why diffusing essential oils are very helpful and very beneficial to your health. All of the oils may be diffused that we carry with doTERRA. This allowed the oil to stay suspended in the air to reduce bacteria, fungus, and mold, as well as neutralize toxins in the air. And I want to stop right there before I finish my textbook explanation of diffusing. I don't know if you've ever been around mold, but I remember I used to live in the city of Chicago and my basement flooded and it began to mold. The mold was crawling up the wall. It was like this black mold. And I didn't realize how dangerous mold was until I became very congested. I felt like I couldn't breathe. And I had someone come in, they say, you have mold in your basement. And I didn't know how deadly. And I want to talk more about if any of you guys have any experience with dealing with mold and the negative impact it can have on the body. I want you to share that with the listening audience, if either one of you all have. Okay, Dr. Cortez.
Wow. Yeah, that's a major one. You see, a lot of people do not realize the detrimental effects that mold takes place. Now, it's not so much the mold. You can see the black mold crawling all over your wall or in your bathroom or in the ceiling. But it's actually the spores that the mold releases, which is called mycotoxins. Now, a lot of people don't even realize they are detrimentally so sick. They can go through doctors, and it's completely goes misdiagnosed. There's a list of symptoms, host of symptoms that it's correlated to mold, and it causes a lot of what is called comorbid conditions as well. Now, the thing about mold is that mold, the mycotoxins, the spores that are released, you do not see and you not smell. But if that mold actually goes into your skin, it can land on your hand, it can go through your eyes, through your ears, through your mouth, through your nose. Now that they start multiplying, and what it actually causes is called chronic inflammatory response syndrome, which is is very, very, very detrimental because it started affecting what is called the brain area, the neuroendocrine system, especially the hypothalamus, because what it does, it diminishes, it decreases a very important hormone, which is called the melanocyte stimulating hormone, MSH. That causes major inflammation. Now, I realized, let me tell you, this is one of the reasons why diffusing the oils, specific oils, to actually go and help to, address the mycotoxins that's in the air. But then, of course, there's other deeper things that has to be utilized.
Oh, and I was just going to say too, Dr. Tony, when I met Dr. Cortez, and I know he says he's a QRA expert, but his expertise to me is that man is given, all of these diseases a name, cancer, diabetes, and they scare us. But they're really tied to a bacteria, a fungus, a mold, and a parasite, if you really look at it, because even though I've watched and worked with him for these months that I have, everybody that I've watched him do an evaluation on, it is already always tied to one of those things, and sometimes two of them. And so when he eradicates that problem, they really have their answer without even thinking. Don't be afraid of diabetes or cancer. Be afraid of that bacteria that's trying to overtake. It's like, the Joker or the Riddler in your house. Let's get rid of him. And we have already eradicated the problem. That's what God wants to know. Fear no name. It's a name. God's name is above every name. And that's what we should use, and use what he left here.
Thank you for that. I appreciate that. I know that there are probably people listening right now who either have been diagnosed with a disease, or know someone, a loved one, a child, or a parent who's been diagnosed, and they want a second opinion. They want to do something that's healthy. They don't want to go down this path of products or prescription drugs that have all these negative side effects, and probably itching to get Dr. Cortez information. So Dr. Cortez, can you let us know where you practice and where people can reach you if they want to come in and get a second opinion?
Absolutely. We have our offices. It's called Diagnostics for You, FOR, and the capital U. We are located at 7520 West Diversey Avenue in Elmwood Park. And that's 60707.
And how can you have is there a phone number?
Absolutely. They can reach at 312-493-5809. I'll repeat that.
Go ahead.
312-493-5809.
Great. And we'll have Dr. Cortez give that information again at the end of the show for those of you all who did not have an opportunity to grab that information just now. Again, we're talking about diffusing essential oils to help reduce bacteria, fungus, and mold, and to neutralize toxins in the air, which is very important. Now, I do want to say, if you are living in an environment where there's a lot of mold, you want to address the mold. You want to get rid of that mold. If you're renting, you want to talk to your landlord to help you with that, because it's very detrimental to your health. And another way that we diffuse oils, we can use them as air fresheners. You may want, instead of using a lot of synthetic sprays, I'm not going to name different names and companies, but some people are out there, they use like aerosols to freshen the air, which can actually have a negative effect on your respiratory, breathing in that type of stuff. So if you were doing something with, making spritzers with your essential oils, not only is it freshening the air, but it's actually helping your respiratory. So that's something you really want to think about if you really want to have what I would call a healthy life and healthy living. Diffusers should be I was going to say diffusers should dispense the oil without heat, which could render the essential oil less effective. So a lot of times people are not sure how they can. I had someone ask me if they could boil water and put their essential oils in there, and I'm like, well, you don't want to change the constitution of the oil by doing that. You really want to get a diffuser that's designed for diffusing those oils.
And Tony, a lot of people are buying those Scentsy candles, pots, where they want to know, can they just take the oil and put it in there like they do the candles? And sometimes they heat, and
Oh yeah.
Those are really, really not good, because when you heat, you destroy.
Exactly.
Okay. And so it's really important that people know that they would put in an incense and you burn that, and all that stuff smell good, but it's really toxins going back into the air. And the oils do the opposite. The oils heal and those kill. So if they can remember, think about marijuana, cocaine, all those things that they're using to heat, and those are toxic. That's why the body's destroyed from taking them. But you can use these to repair the body even when they're dealing with that.
Exactly.
That is so awesome. I want to share a story about when I was running a homeless shelter. And I shared this story last week, but I want to share it again because it really directly relates to diffusing the oils. When I started running my homeless shelter, it was for 75 homeless women and children. And I can only imagine if you're homeless, you're in distress. A lot of people end up homeless after some tragic event, whether they were burned out, divorced, they lost their job. So they're in distress, and they are not the friendliest people to be around. So if you have 75 homeless women and children, there are bound to be some incidents. What I decided to do was to diffuse essential oil throughout the center. And most of the oils were citrus oils and lavender to kind of help soothe the emotions. And I tell you, it was a pleasant place to be around. The women were very calm. The children were not cranky. And I attribute it to the fact that I was diffusing these essential oils. So if there's anyone out there listening who have like a lot of static in their home, they have a lot of anger in their home, they're dealing with angry teens or angry husband or angry wife, and they're just moody all the time, I challenge you to start diffusing essential oils in your home.
Oh, yeah.
I agree.
I agree.
And one example I want to talk about for diffusing, I like to diffuse cypress and clary sage. And I'm going to talk about what these two oils, the benefit of diffusing these oils before we close the show out. Cypress was used anciently for its benefits on the urinary system and other places where there is excessive loss of fluid, such as perspiration, diarrhea, and menstrual flow. So if you have a tendency to have issues with your urinary system, with extreme perspiration and just losing a lot of fluids, you can actually use cypress for that. And clary sage. Clary sage was famous during the Middle Ages for its ability to clear eye problems. And as a lot of other issues. So clary sage is very, very powerful. That's one of my other oils that I love. Diffusing cypress can also help lung and bronchial issues. So if you have a tendency, and see, a lot of people tell me all the time, my doctor told me that I have bronchitis. We already know what bronchitis is, right? It's just bacteria. It's a fungus and a bacteria that's in the lung, and that's something that you can get rid of. But people, when they tell you they have bronchitis, it's almost like they're wearing it as a badge of honor, like, this is mine, this is what I have. But once they get rid of that bacteria, then they no longer have this bronchitis. And diffusing cypress is really good with helping people get rid of that lung congestion. Clary sage, if you diffuse the clary sage oil in the room, it may help with the feelings of depression and sadness. So a lot of times you have I have a young person that lives in my house. So, teenagers, when they break up, they're so brokenhearted and they come home and they're like, they think it's the end of the world. You can diffuse a little clary sage to make the situation a lot lighter. And another one I want to talk about is peppermint or eucalyptus can be also very good in diffusing, especially if you have a child or even if you're yourself. If you're facing a cold or flu, diffusing those oils make you feel a lot better. Any comments on that from my listening audience? From my guests?
Oh, I know. I tell all teenagers to get some clary sage, and we have a blend called Clary Calm because it does just that. Just put it right on those little organs right there, those fallopian tubes, and it just shuts things down, and the emotions kind of calm down. But you're absolutely right. Those are two powerful blends for women.
Dr. Cortez, any comments about diffusing oils?
Well, of course, as we all know, and it's an ancient history, and I believe Cleopatra was very, very, very big with oils. And one of the reasons why, not only that it made everybody feel really comfortable, happy, calming, smoothing, but, she pampered herself with oils. And I imagine this is very biblical. This is not this. The ancient oils are in the Bible. Frankincense and myrrh, for example, was one of the biggest and I think most amazing gift that was given to Jesus.
Thank you for that. We're running out of time, so I'm going to extend this topic to next week, where we're going to talk even more about how to use essential oils, because really the list is endless, and I want to get into some of the ailments that people may be suffering. They could be simple ailments. Well, I won't say simple because an ailment is an ailment, exactly. Whether it's sinuses or allergies or acne or boils. And just because I know the people that are listening, they're probably saying, well, what about me? I have this one condition. How can that help me? And we really want to extend this topic and talk about what oils to use when and where and how. So with that being said, I want my listening audience to get some paper and pencil, get their paper ready and their pencil, because we're going to talk about how you can reach all of us in the future if you're interested in changing your life for the better. Again, you are listening to Dr. Tony Akers with Your Inner Wellness on Intellectual Radio, and we're sponsored by C&W Plumbing and Sons, Inc., where they do plumbing and bathroom repair. For more information, you can contact Adele at 708-268-6489. And to contact me, Tony Akers, you can call me at 331-215-4884. Audrey, give them your contact information.
Yeah, so feel free to reach out to me at audreylee.com. That's AUDREELEE.com. Or you can call me at 4Audrey, and that's AUDREE.
And as far as contacting me, you can actually contact me at rcortez, CORTESQNC @gmail.com. And you can reach me at 312-493-5809. And I want everybody to remember that the foundation of all happiness begins with the grace of our Lord and also good health.
Thank you for that. And every statement, the statements that have been made, have not been evaluated by the Food or Drug Administration. The products mentioned and the information shared is not intended to diagnose, treat, cure, or prevent any disease. If you are pregnant, nursing, taking medicine, or have a medical condition, contact your physician before using any natural tips or products that were shared on this show today. With that being said, we thank you and be well.
Thank you.